Thank you for joining us for the HPL seminar. For a second, I was worried that the room wasn't filling up enough, and then everyone just came in the last 30 seconds. So thanks for being here. It is my pleasure today to introduce our speaker, Dr. Colin Firminger, a postdoctoral fellow working with Dr. Michael Asmussen and Dr. Brent Edwards. Colin completed his Bachelor of Science in Mechanical Engineering from 2007 to 2012 from here at U of C, before transitioning into biomedical applications through an MSc in Biomedical Engineering, which he started in 2014 and finished in 2016, also from the University of Calgary. During his master's, he investigated metatarsal overuse injuries in minimalist footwear. He then continued advancing his work at the tissue level during his PhD in biomedical engineering from 2016 to 2021, also here at the University of Calgary, in which he focused on mechanical fatigue on the patellar tendon. Outside the lab, Colin is perfecting his at-home latte art skills, an effort supported by an admittedly much too elaborate espresso setup. This hobby pairs well with his life alongside his two and 4-year-old sons, who ensure he gets no sleep at all, so he's busy making those espressos. And I told Colin I also recently got into latte art, and my latte looks nothing like art. The foam either just sinks down or sits right on top like a blob. So if he learns that, he has to teach me. Today, he will be presenting his work from his postdoctoral research in a talk titled Effect of Footwear Longitudinal Bending Stiffness on Metatarsal Strains During Running. Thank you, Colin.
All right, thanks, Ashna. So, running injury is pretty common amongst runners. It has an annual incidence between 24 and 76%. And this diagram here kind of shows some of the most common locations in the lower limb. So, starting proximally, we have IT band friction syndrome. Moving down, we get patellofemoral pain. We have shin splints. We can have Achilles tendinopathy. And then moving into the foot, we have plantar fasciitis. And what I'm interested in is stress fractures with an incidence between 2 and 6%. So of stress fractures, metatarsal stress fractures account for about 19% of those. The metatarsals are the bones highlighted here in red. You can see that they kind of bridge the gap between the hindfoot and the phalanges. They're these long, skinny bones. And because of that, they're highly at risk. So of the 5 metatarsals here, most of the stress fractures occur in the second and third metatarsals, these guys here, those two. 89% occur back in those 2 bones. And that's because of the 5, these are even skinnier, and they still experience quite a bit of the load that we put on them during running. So just highly susceptible to these stress fractures in these 2 locations. Stress fractures have a bunch of characteristics that make them pretty annoying to deal with. So they have this insidious pain during activities. You don't really know how it started. It just kind of starts out of nowhere during an activity. And over time, this can start from like a slight pain to something that becomes debilitating. So you're no longer able to participate in that activity that's causing the stress fracture. On top of that, they're pretty difficult to diagnose. So here's some images of a stress fracture of the second metatarsal, so this bone here. The first image on the left is an X-ray at the initial consult. So I'm not an X-ray tech, but I cannot see any kind of fracture there. And then the second image is 4 weeks later, and the only evidence of stress fracture is this slight callus formation. So the bone's actually healing, and that's what we're seeing. We don't actually see the crack itself. So the sensitivity of diagnosing a stress fracture with medical imaging is about 15 to 25%, so not too great. So they're hard to kind of pinpoint when they happen, they're hard to diagnose, and they have a long recovery time to about 13 weeks. So once you get one, it's kind of difficult to get rid of it. It's also cool to see that, or not cool to see, it's interesting that females have a higher risk of stress fracture by quite a bit. So one study showed that females, the risk of stress fracture is 5.7 injuries per 1,000 person years versus males with a risk of 2.8, so more than double. All right, so how do stress fractures happen? I'm going to pull an example from Microsoft Office. You guys are probably, a lot of you are too young to remember Clippy, but he was an annoying little assistant back in Microsoft Word. So one day we're pissed off at Clippy. We want to break him. So what we're going to do is we're going to flex the paperclip open and flex it back close. And that represents one loading cycle. And that's not enough to break him right away. So let's try it again. We do second loading cycle. If we keep repeating this over time, n number of times, eventually it'll come to a time where there's failure. So what's interesting about this is that failure wasn't one loading cycle that outright overloaded that paperclip and caused it to break. It's many cycles frequently over and over again that are causing damage to a groove in that material, and over time that'll cause it to fail. That's kind of similar to what's happening in a stress fracture. So in stress fracture pathophysiology, we have this repetitive submaximal loading that's occurring on the tissue. So in our case for running, we're putting load on our foot every time we take a step. And that leads to the accumulation of microdamage within the bone. So here is an example of some microdamage. It's just a small little crack there that happens in the bone matrix. And over time, that microdamage accumulates. So in response to this microdamage, the bone has this targeted repair response. So what it can do is it can try and find and repair that damage. And in the ideal situation, that bone will, the specialized cells that come to repair it will do their job, that microdamage will get repaired. However, there's some other cases that can arise. In response to that targeted repair, there can be a potentially a local increase in the porosity of the bone. So how bone repairs this microhack is it sends some cells in to kind of burrow it out, and then cells behind that come in and replace it with new bone. So there's this period in that in between those two where there can be this temporary increase in porosity, and that could potentially lead to increased load on the remaining bone tissue that's left over. And if we continue this cycle, that could potentially lead us into a bad situation. The other way that stress fractures could potentially occur is it in response to this, if this targeted repair response just isn't enough. So if our accumulation of microdamage is just overwhelming that repair response, we have microdamage that isn't repaired, and if we continue this repetitive loading, that'll again lead us into this paradigm of stress fracture. So both of these two kind of pathways are still debated in literature. We don't exactly know what's going on, but know that with this repetitive loading, there's some sort of response that can lead to this susceptible nature of going into stress fracture. All right, so in our lab, we like to try and quantify stress fractures as fatigue phenomenon. So what does that mean? Well, if we go back to our example of the paperclip, essentially we can track the magnitude of load that we're applying to that tissue, so in this case bone. We can also track how many cycles that bone lasts until it fails. So this is some data from fatigue-like tests of bone. We're on the y-axis, we have the strain that we're loading that bone at, and on the x-axis, we have the number of cycles of that samples lasting. So what's important to see here is that this is a very it's a highly nonlinear relationship. So the x-axis here is in a logarithmic scale, which basically means that small changes in the y-axis lead to big changes in the x-axis. I'll just show a quick example of that. So if we load our bone at about 6,000 microstrain, it's going to last about 1,000 cycles. If you reduce that strain to about 4,800, so not even half that magnitude of the initial load, it lasts 10,000 cycles. So not even a 50% reduction in the loading magnitude leads to a 10-fold increase in the number of cycles that that bone can last until it fails. So essentially what this summarizes is small changes to the magnitude of load that we're applying to the bone that might even seem insignificant can result in large increases in the number of cycles that that bone can last until it fails. So it's important to try and find ways that we can potentially reduce that load on the bone, even if they're small. So in my master's degree, I kind of looked at something similar to this, metatarsal strains in minimalist footwear, and I was looking at how much strain that bone was under. So in the graph here, we're looking at the peak strain on the metatarsal bones. We have all 5 of the metatarsals here, and the yellow curves or the yellow plots are the minimalist shoe, and the blue plots are the traditional shoe. So our minimalist shoe here has very little cushioning; it's very flexible. It's designed to mimic barefoot running, and our control shoe in this study is just a normal running shoe with no kind of balance control, just a regular cushion. You can see here, for peak strain for all 5 metatarsals, there's a significant increase in strain in the minimalist shoe compared to that traditional shoe. And what was driving that? Well, if we look specifically at the inputs into our model that we're using to calculate strain, we have the angle of the metatarsal and the force applied to that metatarsal. So if we specifically kind of zero in on metatarsals 2 and 3 here, we can see that in the control shoe or a regular shoe, the angle was significantly higher than in the minimalist shoe. So essentially, to kind of say that colloquially, the metatarsal was staying flatter in that minimalist shoe at the time point of peak strain. So that was causing this increase in strain, paired with a change in force magnitude. So if we now look at the peak force magnitude applied to the bone, in the control shoe, it was about 784. For the second metatarsal, that went significantly higher to 793. And the third metatarsal went from 283 to 296, also a significant increase. So we had 2 kind of things happening here in this minimalist shoe. We had the bone sitting flatter, so or different orientation, and increased load applied to it. And those kind of paired together to create this perfect storm for increased strain on the bone. So in that minimalist shoe, there's a few things going on. There's changes in cushioning, changes in longitudinal bending stiffness. So it's hard to say exactly what was causing the results we saw. So it's important to kind of look at different ways that we can systematically evaluate this. So I was particularly interested in longitudinal bending stiffness. So what is that? Well, longitudinal bending stiffness is the shoe's resistance to flexion along the longitudinal axis. So if we look at a minimalist shoe here, it's really easy to curl it up. You can almost roll it into a ball. And so that has very little longitudinal bending stiffness. If we look at a more traditional running shoe here with a lot more cushioning and a lot more just material on it, it's a lot harder to flex that shoe. So we would say that has a high longitudinal bending stiffness. If we look at super shoes or advanced footwear technology, they're specifically designed to have a higher longitudinal bending stiffness than normal footwear. And that's because they have this carbon fiber plate that kind of runs through the middle of the midsole. And it's designed to, as a stiffening element, essentially. So it's designed to increase the shoe's resistance to flexion for the purpose of allowing someone to run potentially faster. So longitudinal bending stiffness has been investigated with respect to plantar loading in some modeling studies, and there's some very interesting findings on the effect that this has. So if we look at this study here, essentially what they did was a finite element model of the plantar pressure in a bunch of different conditions. So in the far left condition here, this is the shoe with no stiffening element in it, so no carbon fiber plate. You can see this is the kind of plantar pressure distribution they get, where red is high and blue is low. So under the metatarsal heads here, you can see some high pressure happening. The next three are all with the carbon fiber plate that was modeled inside the finite element model. And the carbon fiber plate, as we go to the right, is getting thicker and thicker. So you can already see, compared to the no carbon fiber plate condition, the first thinnest carbon fiber plate condition already has a reduction in that peak strain or stress happening under the metatarsal heads. And as that plate gets thicker in the model, those peak stresses get even lower. So although this is just a modeling study, it's very interesting to see that this could be a potential effect of increasing the longitudinal bending stiffness of a shoe. Second study, they also took it one step further, and then they modeled metatarsal stresses in different situations with a carbon fiber plate, and they showed that the increasing the carbon fiber plate thickness decreased those metatarsal stresses. This is cool, but it's not actual experimental data, so it's kind of still important to see what happens in the real world with these situations. So with that being said, the purpose of this research was to examine the influence that shoe longitudinal bending stiffness had on metatarsal strains. And I hypothesized that, aligned with some of the background that I just presented, metatarsal strains would increase in shoes with a lower longitudinal bending stiffness due to a potentially less dorsiflex or flatter metatarsal orientation, and an increased applied load to the metatarsal. So in order to tackle this, I took a pretty common shoe in the AFT world, the Nike Vaporfly 3, and had men's size 10 and women's size 8. And I had two conditions of this. The first condition with the intact plate was basically didn't touch the shoe at all. It was just kind of the stock shoe. In the cut plate condition, I made 6 medial lateral cuts through the forefoot of the shoe. So you can see all the cuts here. They went all the way up and through the carbon fiber plate. So this was an attempt to try and systematically lower the longitudinal bending stiffness of the shoe while keeping as much other stuff constant as possible. So we had some subjects come in and do some treadmill running for us. We had 16 people total, 8 of them were females, 8 of them were males. The inclusion criteria was pretty standard. They were all recreational runners who ran at least 10 kilometers per week, had no prior history of foot injury or no lower limb injuries from the previous 6 months. And they were able to run at a 5-minute per kilometer pace. So it's just a quick video of one of the people that we had in. They ran at 5 minutes per kilometer for 5 minutes in each of those two shoe conditions, during which we captured motion capture and plantar pressure data. All right, so once we had that plantar pressure and motion capture data, we wanted to put it into a musculoskeletal model of the metatarsals so that we could estimate exactly the loads that were happening on it. So I'll take you through that quick. This is a second metatarsal bone here and the second phalange bone. And essentially what we can do in this model is split them into two different rigid segments. So the metatarsals, now this segment here, and it is anchored at the base, and then our phalange is just kind of floating off. So if we know the force acting on the metatarsal, or the toe, then we get that from the plantar pressure data. We can model two different forces acting from the musculature that crosses under the metatarsal phalangeal joint. One is the long, we call it the long tendons, and the long force of the long muscles, and the other one is the short tendons or short muscles. If we know the distance from that toe force to the metatarsal head, and we also know the distance between the plantar musculature that goes under the joint there and the metatarsal head, we can solve that system of equations and come up with an estimate for the force acting on the metatarsal head due to that plantar musculature. We can combine that force with the metatarsal, directly measured metatarsal head force that comes from the plantar pressure data as well. And if we know the angle alpha that metatarsal is at, so the orientation of the metatarsal, we can convert those two forces into a shear component acting on the metatarsal head and an axial component acting on the metatarsal head. So this all really relies on a good estimate for that metatarsal orientation alpha. So what we've done in the past for this is a combination of two things. We take a non-weight bearing neutral metatarsal orientation, which we get from a clinical CT scan. So the person will go into a normal CT scanner, lying down with their foot kind of flat, and we'll take a scan of their foot and call that the neutral orientation. And we'll add that with what we get for motion capture. So we have a rear foot angle that we get on a motion capture. If we add that neutral orientation with the rear foot angle, we can come up with this dynamic estimate of the metatarsal orientation. So we know how important that is, and we know we're not exactly sure what the foot's doing inside the shoe. So what we wanted to do is actually incorporate a potential correction factor for that angle alpha for the metatarsal orientation. And we thought that would be a good idea to try and use weight bearing computed tomography to do this. So in weight bearing computed tomography, you're actually able to have the person standing inside the CT scanner and grab images that way rather than having them be prone. And it gives us this ability to potentially get these different weight bearing postures that we can use to correct our data. So we have participants come in for a second session in this weight bearing CT scanner. You can see the setup here. We had the scanner itself where the people would stand, and then we had motion capture cameras set up all around it so that we could do the same kind of motion capture that we were doing in the first session. And then we had people stand in a bunch of different postures. So we had them stand in the non-weight bearing posture to mimic what would happen in the clinical CT setting. We had them stand in a full weight bearing flat posture. So all the weight was on the right foot and their left foot was just kind of in the air. We had them stand at a 50% peak dorsiflexion posture, and that was estimated from the running session. So we took half their peak dorsiflexion from that running session, made them stand in it in this session, and then peak dorsiflexion also from that running session. And we did this for both shoes. So from this, we came up with some data that we could use to potentially correct that metatarsal orientation. So on the y-axis here, we have our motion capture estimated angle. And then our x-axis here, we had our directly measured angle of the metatarsals from that weight bearing CT. Each of these is a different data point from each one of those scans of all the participants. And we can essentially come up with these two curves that we can use to correct the data. One curve is for the cut plate, one curve is for the intact plate condition. So yeah, that's kind of what we use to correct that data there. All right, so now we know we have estimates of the force acting on the metatarsal heads. We have hopefully a pretty good estimate of the orientation of the metatarsal inside the shoe. Now we can make a finite element model of that to come up with the actual strains acting on the metatarsals. So we did this using 10-node tetrahedral quadratic elements with a maximum edge length of 3 millimeters. We used linear elastic material properties that we applied to all the boxes or all the elements within our model there. A Young's modulus of 20.7 gigapascals and a Poisson's ratio of 0.3. And there's just some numbers there of the number of nodes and elements for the second and third metatarsal for the females and males. So second metatarsal had about 12,000 nodes, 6,500 elements, and the third metatarsal was slightly smaller, so it had a little bit less. We also had to figure out the boundary conditions for the model. So essentially we constrained the base of the metatarsal similar to the musculoskeletal model that I just explained. That was constrained in all 3 dimensions. And then we applied the axial and shear forces that we calculated to the metatarsal head. So here we tried to identify kind of the articulating surface of the metatarsal head and distribute those axial and shear forces across that articulating surface. Once we run the model, we use it to extract those strain data from it. So what we chose to do is extract the 99th percentile strains from our distribution here. So this is a big distribution of different strains across the entire bone. From 30% of stance to 80% of stance. So 0% of stance being heel strike, 100% of stance being toe off. We're kind of grabbing that late middle stance space because that's when we know metatarsal strains are generally the highest. And we're grabbing them from the diaphysis region. So just the skinniest part of the bone there, because that's generally where the highest strains occur, and that's where we normally see metatarsal stress fractures happening. So this is kind of just a standard time series plot for what the strain would look like, the 99th percentile strain. So again, we're solving finite element models at every 5% of stance, all the way from 30 to 80%. So each one of these is its own little finite element model that got solved. And that's the 99th percentile strain value there. So all we're taking for the analysis that we're going to do is just the peak value. So that one that comes, and that's what we're analyzing. All right, so some results. I wanted to make sure that the cuts that I made in the shoe were actually doing something. So I measured the longitudinal bending stiffness for the two shoe conditions. And I was also curious to see what that effect might have on just the compressive stiffness. So I just did some direct compressive measurements as well. So the intact plate condition for the men's and women's shoes is about 0.5 Newton meters per degree. And then the cut plate condition is about half that. So 0.28, 0.25 for the men's and women's shoes respectively. So definitely had an effect putting that carbon fiber plate in terms of longitudinal bending stiffness. Interesting to see though that it didn't have much of an effect on the actual just linear compressive or the axial compressive stiffness on the shoe in the forefoot. So in the intact plate condition is about 64 newtons per millimeter of stiffness if you just squish the forefoot, and it went up to about 66 newtons per millimeter in the cut plate condition. So slightly stiffer, but not a huge change there. All right, so now if we get into some of the results for the peak 99th percentile compressive strain in the second and third metatarsal here, you'll see plots for both the cut plate and the intact plate condition. And for the second and third metatarsal, unfortunately, we didn't see any effect of longitudinal bending stiffness on peak strength. So no significant change there. It was good to see that the third metatarsal strains were slightly lower than the second metatarsal strains. That's kind of what we'd expect, but no change due to the plate condition. We did, however, see significant increases in axial force, so the force that was applied to the metatarsal head in the axial direction in the second metatarsal. We didn't see any change in the third metatarsal, but there was a trend for an increase. And we also saw a significant increase in shear force acting on that metatarsal head in the second metatarsal. So for both these two cases, the cut plate condition had significantly higher shear and axial force applied to that second metatarsal head. Same news for the third metatarsal here. It was a trend for an increase, but not significant. So this is kind of confusing. We saw no change in strain, but we saw this increase in axial force applied to the metatarsal head. We also saw that the time point of peak strain occurred later in that lower longitudinal bending stiffness shoe, the cut plate shoe. So this is a representative subject here, just looking at the time series data of the strains there. And the peak strain here occurs significantly later than the peak strain in the intact plate shoe. And if we just kind of plot that in box plot form, we can see that for both the second and third metatarsal, that time point of peak strain occurs later in that cut plate shoe. So if the strains are, there's something happening there with the timing, and there's something happening there with the force that's just not translating to a change in the actual strain metric. So what we wanted to do is actually split it one step further into the female group and the male group to see if there was a change happening because of sex. And we actually did see something cool. We saw a significant increase in that peak 99th percentile strain in females in the cut plate shoe, and we saw no change in the male group. So where is this change coming from? Well, there's those two kind of inputs that we can look at into the finite element model. There's the metatarsal orientation, and then there's the magnitude of force that we're applying. So in terms of the orientation of metatarsals, there's no significant change between the two. So the cut plate condition, the metatarsal angle for the second metatarsal is about 45 degrees at peak strain, and for the intact plate condition is about 43 degrees, not significantly different. But there was significantly increased forces applied to that metatarsal head in the cut plate condition. So the axial force went from 293 newtons on average to 341 newtons, and that shear force also significantly increased from 161 newtons to 157 newtons. This is also reflected in the planar pressure. So if we look at a representative subject here, this is the planar pressure at the time point of peak strain. So this is just kind of a heat map of the pressure under their foot. Red is high, blue is low. You can see that intact plate condition here, slightly less red compared to the cut plate condition where it gets a little, the area kind of grows and the magnitude also gets a little bit higher too. So that's probably what's driving those increased forces. We also looked at some of the spatiotemporal differences between these two just to see if that was a factor as well. And we did see some significant change, or a trend for significant changes here. So intact plate versus cut plate stance time, it decreased slightly from 234 milliseconds down to 227 milliseconds. P-value that was 0.1. And the stride time consequently increased to reflect that. So the impact plate was about 652, and that went up to 659. So slight spatial temporal changes actually happening. All right, so we saw this cool change in strain happening at the second and third metatarsal in females, but what does that mean practically? What we can do is actually take that fatigue life data that I talked about before, and we can use that to show what the effect or factor of a change in strain has on the number of cycles together. And what we can actually see is that 200 microstrain increase that we see when we go from the intact plate to the cut plate condition in the second metatarsal actually corresponds to a 1.7-fold reduction in the number of cycles to failure. So 1700% reduction in number of cycles to failure from that 200 microstrain increase that we see. Same thing for the third metatarsal, although the strain increase that we observed from the intact plate to the cut plate shoe is slightly smaller, so it's only 160 microstrain, and that corresponded to about a 1600% reduction in the number of cycles to failure there. So the conclusions from this work were that this reduced longitudinal bending stiffness shoe was associated with significant increases in metatarsal strain in the female running population, which represented about a 16 to 1700% reduction in the number of cycles that those metatarsals could withstand before fatigue failure. So when we look at this and frame this in terms of metatarsal stress fracture risk, this research potentially shows the benefits of using AFT shoes, at least for metatarsal stress fracture reduction in female runners. Now I'd like to thank Dr. Mark Asmussen, Dr. Skarmansky for her help with the weight-bearing CT, and Dr. Brent Edwards and his lab mates for their great help with this project. So thank you.
Is that the floor is open for questions? Who would like to start us off? Robin.
Thanks, Colin. I'm curious about how you choose your sensors, like from the insole to match with the bones were.
Yeah.
How do you do that?
I was just kind of grabbing, and go back to that server. Okay. I was basically just grabbing all the cells within the general region of each metatarsal head and each toe, and applying that pressure to the metatarsal head. So it could be slightly larger than what's the actual metatarsal is experiencing, but it's generally within the region. Kind of each, that's the first metatarsal, and then we kind of work our way across and segment out each metatarsal discreetly. Yeah, there's no like amazing way other than that I've seen to do it, other than like discreetly just mapping it into different zones. So we might be slightly missing it. Potentially we're getting too big of a region, but that's kind of the limitation of just working with those pressure sensors with those discrete cells that they have there.
And also question for like your female participants, you had like one pretty big outlier for the strain, I think. Do you know if it was driven by a change in force, a change in angle, both?
I'm not sure what was driving that specific person. I would suspect it's probably a force thing and not an orientation thing, no. Yeah, if I had to guess, yes.
Thanks.
Yeah.
Were your participants running, I think you mentioned this in your methods, but were they running at different speeds that were based on each participant? Or?
They all ran at 3.3 meters per second, so 5 minutes per kilometer.
And have you seen anything that has to do with the speed, like an effective speed to be kind of okay, or that?
I couldn't analyze speed because they're all the same one. They're all the same speed.
Oh, I'm so sorry.
Yes.
And answered my question.
Yeah.
And I for some reason heard they were all running at them.
No,
Yeah,
they're all the
that makes
same.
sense. Yes.
Yeah.
Can you speculate them? Just talk to your rescue.
Yeah.
Thank you.
Yeah, I don't know if there'd be an effective speed or not. I mean, at some point you do have to be kind of engaging. Like if you're running fast, you're probably getting more flexion out of the shoe. So it might be able to kind of amplify the results that we're seeing, I think. So you'd be kind of engaging the plate or the non-plate more. So that might, yeah, I suspect it'd probably be kind of a higher speed thing. And that's kind of what Patrick saw too in his research when he split it into the faster females that he was collecting versus the slower females. He saw an effect and he grouped it all together. He didn't see one. So yeah.
I mean, I think even going back to the fact the forces will increase, right, as you go up with speed, so probably.
Yeah.
But I don't know, yeah, the within subject, the change between the cut and no cut would be
Mhm.
interesting to see, but yeah.
Yeah.
Thanks, yeah, that's what I was. So. Yeah, go ahead.
Very nice talk. Nice to listen to. I like the applicability at the end there. I wanna make sure I understand it. Let's assume my feet are perfectly symmetrical.
Mhm.
And I run every day with your cut shoe on the right foot and my uncut shoe on the left.
Mhm.
You're telling me if I get a stress fracture in my right foot cut shoe, I can run 17 times more the total distance up to that point until I get a stress fracture in my left foot.
1.7. And that's
1.7.
based
Sorry, said
1700%. Kind of make the number bigger so it looks cooler.
Okay, well, you got me.
Well, you're not gonna see an effect because you're a male. But if you're a female, you might see. it.
Yes,
Yeah.
that's.
But that, I mean, it's nice to kind of be able to quantify it in terms of number of cycles of failure, but we also, need to account for a lot of biological processes that are happening and stuff too. So it's definitely, I wouldn't stand behind 1.7 with my life, but it's interesting to kind of frame it that way to see like the small change has this huge effects.
I follow up with stuff. When did you do this?
When did I collect this data?
When did you cut your shoes? There was another study that cut the vapor fly.
Yeah.
And what did they find?
They weren't looking at metatarsal strains or anything, they were looking at like expired gas.
Right.
And I think they found no change.
No
For sure, yeah. So they're showing us more of the cushioning.
I always think you should cut it both ways. Like not just horizontally, but also.
Yeah.
Like there's other stuff happening. It's not just purely.
If we wanna get into like the running economy side of things, I think there's. Kind of changed my mind on the effect of the plate. I think the effect of the plate is to engage more of that super efficient foam. Because if you have this stiff plate underneath, right, like your small metatarsal that indents the plate is gonna affect way more foam. And I think that's kind of what they were showing too, it's driving, so.
I have one more question. So, you gave two stiffness values for material testing. Can you explain what one was a push down and just bend?
Yeah.
Stiffness, and one was used per degree?
Yeah, so one was a flexion test and one was just a straight compression test.
You know, I assume there's a difference between the shoes. Are we using the wrong test?
No, there is a difference. You're right. Yeah.
Yeah.
So this longitudinal band stiffness test is you climb up the front of the shoe and then it flexes the heel, right? So it's just flexing along the long axis of the shoe. So that would be showing changes because of the cut plate. This 4-foot compressive stiffness, I just put the shoe flat in the instrumental materials testing machine and compressed it
And you kind of have
like vertically.
two orders where the 4 foot sits in between and we push down.
That's no. This is just the shoe sitting exactly like this. I have a piston pushing down flat on it.
Thank you. Okay.
So I just wanted to see like, are these notches that I'm cutting out, are they affecting how stiff the shoe is this way? Like when we compress it vertically, because if that changes, well then we're creating a completely different system, right? That could be driving some of the changes, but we weren't like, that change is pretty small.
Yeah.
So we're showing it's probably mostly due to the longitudinal stiffness and not the compressive stiffness.
Yeah. Got it. Thank you.
I have a question along those, the medial lateral cuts.
Mhm.
You made the cuts and they're obviously like a certain distance apart.
Mm.
Do you think the alignment of the person's head of the metatarsals with those cut versus not on those cuts would play a role in your results?
I think it could, but I think there's also like, if you look at where that plate is positioned in this part of the shoe, it's pretty far down, so there's a lot of foam between the metatarsal head and the actual plate itself. So it could, but it's also, think of it, there's probably like a huge low pass filter between what the metatarsal is experiencing and where the actual plate is, so it could, but it'd probably be pretty minor, I would think. But yeah, it could be a factor like where that slit actually ends up being. Yeah, potentially.
One of the figures you showed at the end that had the two metatarsal bones, we also talked about the magnitude there, but it also did like an area with.
Yeah.
A lot more area with red. Is the area that the bone experiences certain magnitude times that?
I quickly, because I saw the same thing, I was like, oh, maybe that's something that's cool. I quickly calculated like all the number of elements with a strain greater than whatever, 95%, I think, and it was there was no significant difference between the two. So I think that might just look like it, and it might actually like be for the high end, so it might not be able to say.
Yes. So why the difference between males and females? Why is females it's not?
Yeah, that's a great question. I could speculating, I think it could have something to do with anatomy, like are the females, the plate is essentially the same plate in both shoes, I'm pretty sure, like same thickness, so does it functionally feel stiffer for females? So that when the plate gets cut, maybe it's a greater perception of reduction compared to the males who are able to kind of flex the plate more in the intact plate condition, and then the cut plate condition isn't as big of a change for them. That could be something. There was a trend for the males to have an increase in strength. So maybe it'll come out too with more participants. I don't know, but yeah, that's kind of what I was thinking. It's potentially towards like an anatomical, like females have smaller toes compared to males, so maybe they're just able to engage the plate less. So when they get that cut plate condition, it's a bigger change. I don't know.
So what about the, initially, I think you gave some statistics that females also are 2 times more prone.
Yeah.
To the injuries and metatarsals compared to.
That wasn't specifically metatarsals, that was just stress fractures in general. Yeah, it was all over those stress fractures, yeah.
Is it because the quality of the bone is, as the age?
I think there's a lot of factors going into that change, but I think bone quality is one of them for sure, yeah. Bone quality, bone morphometry, there's a lot going into it, yeah.
Okay, I'll go with other people first. Matt, Brent, and then Florian.
Thanks for the talk. I really like the way that you estimated like the angle and then like corrected for that. If you were to repeat the study and you did like a fluoroscopy, how close do you think you would be ultimately? And then like essentially like estimating that range.
I mean, the corrections that we were getting were actually, unfortunately and frustratingly, pretty minor. I was like, I'm gonna change the field, but they were pretty small. So I think we'd probably be pretty close to the fluoroscopy, at least in the sagittal plane. I've done a walking study tracking the first metatarsal with dual fluoroscopy, and there's some subtle things that we've missed, like there's some toe flexion down into so there's actually a tiny bit of actual plantar function that occurs right at the beginning of the stance that we wouldn't capture with this, and there might be slight changes, but grossly I would say it's pretty okay, yeah.
You showed a slide that I haven't seen before. It's this idea that for the women, just the plantar pressure data for the women. Okay, so the women had, in the forces were higher underneath the metatarsal head and the cut blade at any time. And that makes sense to me, but only from the standpoint that I would have thought what the plate is doing is better distributing the load. So what I would have expected to see is a greater area of red in the intact plate. Sorry.
Yeah, great.
Yes,
Loading.
greater area of loading in the intact plate, but a lower peak. What you said is that not only does the magnitude of the pressure increase, I mean, the red gets higher. You also said that the area is higher.
Well, I didn't test that, so maybe I'm misspeaking on that one.
While I'm looking
It
at
looks
it,
higher.
I'm believing you.
That's one person. Let's not go crazy.
Okay. Because otherwise, I don't really know how you would explain that finding.
Yeah. other than a change in like the compressive stiffness potentially I mean, it was slightly stiffer. So maybe that's the function of that. I don't know. That is kind of weird though, you're right.
I mean, I'm assuming that the ground reaction force is really changing between two different conditions. So if you have more force and more area,
It should be.
there's the greater I just, sorry, more pressure and more area.
Yeah.
Then, so it's, I just don't.
I'll look into the area and see what the actual change is as we call
Okay.
Kind of follow up on that, do you ever look at it just bending the insole? How much the sensors read pressure just by bending the insole?
I did test that after you told me to test it, and it's pretty minor. Like there's not a lot of artifact just from the function going on.
Okay, because I was gonna say that could be part of it, because I know the Metatarsal.
Yeah.
Definitely had artifacts.
Yeah.
From bending and then applying load, applying load in a bent shape, the increase in pressure reading, the more
Right. The flat.
you apply that same load flat.
Right. Makes sense.
Orion,
Sorry.
Orion had a question?
Yeah, then more in terms of technicalities regarding the issue.
Mhm.
You said that the thickness of the plate is the same for male and female.
I think it's similar, like because the longitudinal bending stiffness was almost identical between the two. I'm inclined to think that the plate is probably the same.
So if you then would go further with that, you would assume that for every shoe size, it's the same. Well,
I think so. I don't think they're scaling plate thickness with shoe size. I doubt that's happening.
so what kind of things do you think that would?
Yeah, so like the effective stiffness of that shoe could potentially be different depending on. It's a function of shoe size. It's also a function of like where the load is being applied. So longer shoes should have a functionally less stiff longitudinal bending stiffness, I guess, than a short shoe.
But not the way you calculated in Newton meters per degree.
No, and I don't know.
And so I don't know what way you should be
Yeah,
calculating it,
it's
with
tough.
how a person actually loads it.
Like Tony's
In reality.
calculation that he presented Dr. Art was showing kind of pulling off on the toe. Mine was having the shoe flat on these two plates, and the heel plate kind of moves up and down. And I don't know if that's accounting for exactly where the force is being applied to the shoe. So
Yours is. Cause it's Newton meters per degree,
it's giving you a torque, yes.
so.
But yeah, I don't know. I think we could refine it a little bit.
You were lining the shoes up approximately the same, and like anatomical location.
The point of rotation is always the metatarsal phalangeal joint. Yeah. But for a given, you would think for a given plate thickness, you get a longer moment arm, that shoe's gonna be less stiff, so. Curious.
In terms of applied load.
Yeah.
But it's gonna take the same torque to change it.
Yes, yeah.
All right,
Yeah.
so that's the issue with reporting it as Newton meters per degree.
Yeah.
Other questions for Lauren? Yes. So do you know, like what type of shoes your subjects usually use? Like
I would say not AFTs in general. It's mostly just traditional, like normal, non-plated footwear. What's
So they are more,
like non-plated, so like the low stiffness condition was what they were all doing.
cut plate would be the regular
Yes.
conditions.
Yeah, something similar to that.
So like they are adapted to run in the cut plate, I mean, that's why you see
I
huge difference because the
Yeah.
muscle, the orientation, all that.
I think they were given, I mean, the 5-minute acclimatization that they had, I think was plenty enough to kind of adapt to the shoe, and we saw pretty standard changes that a lot of other research has shown, like the metatarsal phalangeal joint flexion goes down significantly, and that's what we saw. So in that sense, I don't think them being like conditioned to a AFT shoe would really change much. Yeah, so I don't think that was really much of a factor there. Yeah, I can't see a really big thing. If we just got them to put the shoes on right away and go, for like 30 seconds, maybe we wouldn't see them kind of like settling into kind of their, their normal run, but yeah, after 5 minutes, they're pretty adjusted.
Andrew?
So this injury with AMTs all started with this study of N=5, where the language around these shoes was they might create metatarsal stress fractures.
It was navicular, I think, but yeah,
Stress fractures.
stress fractures in general, yeah.
I would argue that you and your colleagues over the last few years have shown at least in these kinds of studies that that's not the case. If anything, it's low.
Yeah.
How much do you believe that state that it reduces the likelihood of getting stress fracture?
I mean, I think it's potentially there, like the modeling study showed, the study shows it, so in terms of metatarsals, I think it's potentially a kind of benefit. Wow.
It's a giant more.
Yeah, exactly.
But and the reason I asked, and I asked this question maybe a year ago,
Yeah,
is that people have been running in these shoes now for what? 7 years?
since 2018, I think was the first paper.
7 years.
Yeah.
Do we have any data about stress fractures in AFTs?
There is some data that's starting to come out.
What's the data set?
It's changing. It was a conference proceedings that was back in October, so I don't know the full thing, but it's the location. I'm not sure if the incidence of stress fracture changed, but it looks like the location is shifting more proximally. So away from the foot and into the femur.
Away from the foot to.
Into the femur. Stress more femoral stress fractures, less medical.
Also less of the foot more. Who did that?
I don't exactly remember who. Aoyaki, I think is the name of the person. They presented at Sports Medicine Australia in October. Yeah. Yeah. So there's starting to get some evidence. Yeah, yeah.
Cool.
Yeah.
Yeah, I'll ask my question I have.
Okay.
Hypothetical.
Mhm.
So let's say you have a shoe that has the same bending stiffness as a plated shoe, but doesn't have a plate in it. Through other factors. So let's say the foam is thick enough or whatever's going on, that the
Yeah.
thickness is the same in bending.
Yeah.
Would you say that we still need a plate in there to be able to reduce those metatarsal strains, or is it just the bending stiffness doesn't matter regardless of how it's constructed?
I think it's probably just the medical stiffness itself. I don't know if it's necessarily the plate that's doing all the work, because again, like that plate is pretty far down in the shoe, so there's a lot of foam. There's like 90% of the foam is on top of the plate, and there's about 10% of the foam below the plate. So, yeah, I don't know. I don't know what methods you have to go to get the shoe with that same stiffness without a plate, but if you could do
Have
it,
one right now.
oh, there you go.
Yeah,
Send it
so
over.
like even curious, like hypothetically, if you were to think of like running energetic results,
Yeah.
would you think that since you have the same bending stiffness, you have the same like kind of energy return, do you
That
have
comes more to
to
foam,
have
I think,
also the same energy cost?
potentially. But then you're getting into like the foam properties too, right? Like, is the foam identical or what's the deal with that? So that's a whole other can of worms, but yeah. Good luck.
Is it compressive strength or tensile strength?
We're looking compressive strength.
But did you look at the tensile strength? Because I know that bone is more sensitive.
Yeah, most of the stress fractures we see,
Damage from happening.
yeah. Most of the stress, or almost all the stress fractures on the metatarsals occur in the compressive side. That's pretty consistent with the tibia too. It occurs in the compressive side of the tibia and the femur. So we're looking mainly at compressive strength. Yeah, not tensile.
But you could get it and.
We have it. Yeah, it outputs it, yeah. But we were just looking at dorsal surface compressive, yeah.
All right, well, any last questions for Colin? So,
I have a, let's say, not related question. So, in your, graph regarding the technical
spatial difference,
Mhm.
spatial temporal,
Mhm.
yeah. So what is happening there, and also, for example, for golf club, for golfing, the stiffness or natural frequency of the shaft is tailored to the
Swing
swing
speed, yeah.
So is there any effect, something like that, tailored stiffness to speed?
I don't know of a study that have looked at it, but I'm assuming there is. There's some research looking at like your metatarsal phalangeal strength, I guess, like how hard you can plantar flex your toes, basically. And there's correlations of that with the stiff, like how stiff the shoe can be for you to get an energetic benefit. And if the shoe's too stiff compared to your natural kind of metatarsal phalangeal strength, then you're not really gonna get a benefit. So in that sense, I think there could be also like a speed effect too. How fast you're running and engaging the shoe basically versus, yeah, how much benefit you're getting out of it. So in terms of stance time, yeah, I don't know. I'm not sure exactly why there was a decrease in the cut plate shoe versus the intact plate shoe. Maybe they're just able to kind of get onto their toes faster and take off sooner. I think that would be my speculation.
All right, that if there are no more questions for Colin, let's thank him for his talk.